Topic of today is insulin resistance first or high androgen levels is causing high insulin levels, or is it the insulin resistance which is causing high androgen level? So is it chicken is first or egg is first? Very important topic for this. Number of articles have come out after 2020. Lot of science has changed about insulin resistance. Lot of young doctors are asking me how insulin is linked to gynecology department. So insulin is found to be very, very important hormone, not only linked only to glucose metabolism, but it is also linked to number of other work structures. The idea is the androgen levels are increased when it is called as polycystic ovarian syndrome. The hallmark of PCOS is PAA. P means polycystic ovaries. Now ultrasound is being used after Rotterdam. Number of changes have happened. So polycystic ovary is one of the bedside markers or clinical markers. Second is androgen excess. You have to prove that there is androgen excess, and another thing is you have to prove it is not due to androgen released from adrenal gland but from the ovarian mass. And third is you have to see that anovulation. So out of these three, if there is polycystic ovary and androgen excess with anovulation, it is called type 1. So number of phenotypes have come out. Approximately 75% of women with PCOS exhibit measurable impairment of insulin action. The insulin, once it is produced, it causes the theca cells in the ovaries to produce more amount of androgen. Why the insulin now so much of high insulin is being given so much of importance is because now everybody is having a sweet brain. We are all having hedonic living. Hedonic means happiness. We are all selfish. We are all selfish now. We are only thinking about ourselves. This is called hedonic living. There are hedonic hotspots in the base of the brain where you like sweet, salt and oil. These three will be addicted now. Entire society is addicted to hedonic living. That is, now because of capitalism, you cannot have time to think about others. Your entire life is only thinking about yourself, and you like pleasure always, and you eat always. Every 2.5 hours we are eating. There are around 8 to 10 meals people are eating. Constant push of carbohydrates. This is a carbohydrate world. Proteins are less and lot of fat we are taking. This is pushing every hour, 2 hours, 3 hours, hunger levels are increasing and increasing. Whenever you take glucose, your insulin levels are going up, but sugar is normal. This is where the confusion. Every doctor is asking me, sir, you are telling about insulin resistance, but we are unable to understand what is this. Because the endocrinology department, they see only out of 100, 11 people will get diabetes, another 14% will develop diabetes, pre-diabetes. So only 26%, maximum 30% out of 100 obese people can get converted into diabetes. So they are not much important for them. And other departments are ortho, neuro, and they are all nowhere they are reading in the medical college insulin resistance. Only one line will be there in Harrison or Davidson about insulin resistance. So the theca cells of the ovaries, once they start, instead of producing estrogen, progesterone, they produce androgen. It is called steroid dysgenesis. This is the fundamental problem with insulin resistance linked to androgen produce. High androgen levels, they cause all the androgen features like hirsutism, alopecia, acne, central obesity, and extreme obesity. These hallmark. So this is causing the abnormal androgen production. This slide why I kept today is I want to show how to use this score. I am using a insulin resistance linked to PCOS. So first step is, once you come here, your name, like you take a gynec staff. You take any name. For example, you can use Gayatri or something. Keep it simple. @gmail.com. Most of the time, because the gynecologist will be busy, any staff member they can use it. First step is you create an account. This video is about how to fill up this link that I have given to you about PCOS score. First time I have created as a physician a bedside, easily at the tip of your finger you will get a how is the patient at high risk or not. This is called a PCOS Homa score. So how to fill that link? Once you click the link, you will come to sign up form. I am showing how to fill up that form. Only phone number is important, plus is important, and 91 is important. After that, your number, any number you can, your own personal number must be there, but 91 is most important, plus. And the name is very, very simple. Keep it like very, very simple name. Mita. And password, you can keep it very simple, not like banks and all you need complicated. It's just a simple password 123. Again here password 123. Just confirm it. Once you sign up, you'll go into the login. Only thing I want to tell you is name and passwords you can keep it very, very simple, because when I sent the link 2-3 times, a number of doctors, because of seniority and busy, they are unable to fill the form. So email address you can keep it very simple. Phone number is only thing is the +91 should be there. After that you can give your number, but now phone number is very important. Name you can give, because somebody may have Smita Dash Agarwal or Smita Agarwal, very long name may be there, KSRV Prasad like that. So that you can simply KSRV Prasad, just write Prasad like that. Password, simple password, don't make it complicated like banking. One capital letter, one symbol like that. No need of all that, numbers and all that. Once you do this, you write a very, very simple password 123. So once your account, you are redirected here. This is the score which I have created. This is called PCOS Homa IQ score. That is, we are linking insulin to the androgen levels. Very, very easy form. You can fill it up. Majority of the time in India, they have fasting blood sugar around 86. But the insulin levels among the young girls who are infertility patients or obesity girls and abnormal ovulation, irregular menstrual cycle, usually the insulin levels are very high. Once you put the fasting insulin level and fasting blood sugar, usually the test costs, including all the factors, lipid profile, fasting insulin, calcium, thyroid, we are charging 3,500. So for around 3,500, you will get a fasting insulin, fasting glucose, lipid profile, and calcium, and all the other markers. Once you calculate, anything above 2 is abnormal, 5.7. In India, BMI is very, very missing, because in India, our upper and lower limbs are thin. We are all still in the medical college teaching about BMI, but waist circumference is more important than BMI. So always the BMI will be normal in India. If you take the weight around 60 kgs and height, usually Indians are around 160 to 170. If you take, it will be almost normal. Always the BMI will be normal, cholesterol will be normal, sugar is normal. You take sugar is normal always. But in India, triglycerides are high because we are eating a lot of rice and wheat. So any triglyceride index more than 5 indicates abnormal. This is where my markers are different. Where I am showing a new model where you can risk stratify. In medical college, we are not at all teaching risk stratify. Everybody is by hearting, chunking means they are breaking the medicine into parts, by hearting and coming and exam pass. After passing the exam, they are not least bothered about a subject. Once the patient comes, they are doing lot of mistakes. They don't know where the patient to be admitted in ward or what to be admitted in ICCU. Total blunder they are doing. Very, very unfortunate in India. Number of medical colleges going up. Zero teaching. Why the government is doing like that? Why the public are like that? That is beyond my imagination. So coming to this, you have to just fill up the age, fill up the weight, fill up the height, and fasting insulin levels we have 27. routinely no doctor is doing fasting insulin. Always they think I am not diabetic. Why should you get insulin test? Biggest headache with while asking is, in what way insulin is connected to a lady gynec problem, PCOS. The fasting insulin is now high levels are proved to be acting on the theca cell of the ovary, causing high androgen production called steroidogenesis. So this is also named as ovarian diabetes. Always the waist circumference in India is very high. We are all crossed 85 centimeters waist circumference. 33 inches, nobody is there now. Now always, if you take the belt size, everybody is saying 36, 38, 39, 40, 42 belt size. The Homa IR is very high, 5.2, and triglyceride to glucose index is 9.1. With that, our BMI is always normal, blood sugar is normal, cholesterol always in India will be normal. So everybody thinks they are Bahubali, very healthy, I don't have any problem. And suddenly they end up in MI and all. And another thing is, we are all having less than 60 HDL. But triglycerides are increasing. Unfortunately, none of the doctors care about triglycerides up to 400. So they look only at the total cholesterol, HDL, LDL, and forget about what is doing below. But triglycerides are very important. And now with any nook and corner, every sonologist can able to make out ovarian follicle. So for Rotterdam, they added modified Rotterdam where they are adding ovarian follicle size. Luteinizing hormone, if you can do in your area, it will be 7.8. And usually follicular stimulating hormone, and this ratio is altered. Total testosterone will be very high, and DHEA levels are done only in few centers. We are not doing everywhere regularly, keeping them normal. But ovarian volume are very high because regularly we are seeing patients. This is 9.7. By doing that, and family history, now every sixth generation Indians who have come out from 1947, they are all having great parents, somebody with hypertension or diabetes or atherosclerosis or chondroitis. Once we calculate, you see that a high risk score is there. To look at the patient appears simple. There is no problem. The normal BMI, normal blood sugar, normal cholesterol. What is the problem? Once we do a insulin resistance, you can make out how much of risk it is there. This group of patients are at a very high risk group. That is where first time in India, in the world, I have created a PCOS score. I want everybody to use this score, and we can do a number of studies on this. This is a research assistant tool. I want to give it at the tip of your finger. Easily you can fill it up. Once you are fill it up, you can come down and put here save. Once you save, we have all the data inside. Once we can go and again recheck, and we can fill it up all those things. So this is a video showing you what is the use of insulin testing in PCOS. Second is, we found out patients who are having high PCOS problems after 30 years, if you follow up, chance of getting a diabetes are very high. Third is, the chance of getting myocardial infarction are very high. This is where it is different from that is why we are following every patient with the PCOS with fasting insulin, and don't leave them. Later on, the chance of getting MI and chance of getting diabetes are very high. So my name is Dr. Surendranehru. I am doing lot of work on fasting insulin, Homa IR, fasting insulin to fasting blood sugar divided by 405. Because metabolism, inflammation, immunology and nutrition, 4 pillars of medicine are not taught in medical college. I took it upon myself with my experience of 30 years that we have to change this model. Metabolism has to be brought to forward. If any doubt, you can ask me, 996 3721 999. If you like this video, share it, and any doubt you can ask me. You can come to my website www.homahealthcarecenter.in, or you can see my videos, Homa Surendranehru, or you can WhatsApp me 996 3721 999. I am working as professor of medicine with 30 years of clinical practice as a physician. Thank you.